In the United States, we spend over $8 billion each year on lost productivity and lost work days due to the flu. Patients don't take the flu seriously because so many of this generation cannot remember what it was like before we had vaccinations for the flu, and flu caused hundreds of thousands of deaths. The most common misconception that I see about the influenza vaccine is that the flu shot will give me the flu. I explain to the patient that the flu vaccine is inactive. It actually cannot give them the flu. There are simple steps that we can all take to lower the influenza rates in our country. That is washing your hands, covering your mouth when you cough, and using hand sanitizer. An increase in immunizations would help our country financially because we know that over 111 million work days are lost to the flu. There's a long list of patients who should get immunized. We first start with children and infants, pregnant women, seniors, anyone with a chronic disease, and certainly healthcare providers should be immunized. The influenza vaccine is annual because the flu is a respiratory condition. It changes year to year, and so the flu vaccine, the strains change year to year. I hope that every pharmacy will participate in the Million More campaign so that a patient can walk in any community pharmacy in America and have access to a flu vaccine this year. Pharmacies are the local hub of the patient's medical records. We receive physician records from many different locations, many different physicians, even hospitalizations and discharge or rehab center. So we are the one place where the patient's medical records all come together. I suggest looking at the CDC's website as well as flu.gov for information on influenza. I would like to tell the general public that it takes all of us to keep our community healthy from the flu. So recommend to your neighbor and your friend to get the flu shot this year.